Seizure. So myoclonic seizure means the patient will maintain the posture, will not lose his consciousness. So everything will be intact. Penetrating power more for gamma, whereas the reverse order for ionizing, that is alpha more than beta more than gamma. HU, Hounsfield unit in CT. Water is 0, minus 100 air, plus 100 is cortical bone. So just imagine between air and water, what will be that? Soft tissue, fat. Whereas so it is between 0 to minus 100, whereas from 0 to plus 100, thicker than water is the blood, hemorrhagic fluid, and then plus 100 for cortical bone. So it goes above, like solid material near to 100. Or autonomic instability in spinal cord lesion above the level T6. Mousy odor is due to phenyl acetate. Silverman-Anderson score related to nasal flaring, grunt, and retraction. Retraction itself, upper chest, lower chest, and xiphoid. Vigorous MSAF baby, remember HRT, heart rate, respiratory rate, and tone. Antibody in GBS is GM1. First line drug for DLA hydroxychloroquine. Drugs exacerbate psoriasis, beta blocker, lithium. Follow-up after breast cancer surgery, you have to do 6 monthly mammography. Then follow-up after leprosy treatment, again for 5 years. Herpes gestationalis is not herpes, it is pemphigoid. Bullous pemphigoid in pregnancy. Uncinectomy or infundibulectomy, it is actually between the maxillary sinus and nasal cavity. Sphenopalatine foramen means that is the posterior to the middle turbinate. Inverted papilloma, that is transitional cell tumor, mostly seen in elderly. The treatment for JNA, it was mainly surgical excision, and if it was non-approachable, radiotherapy. Here no radiotherapy, only excision, which is done endoscopic approach. So some things can be remaining, that means it can be recurrent, and the investigation of choice MRI. Expanded New Ballard score is you are looking for physical and neuromuscular maturity, 2 parameters, and the value ranges between. So in the mnemonic 1, 2, there is no 3, then 4 and 5. So 1 and 5. Take the extreme numbers 1 and 5. So it can be ranging from minus 10 to 50, and according to weeks it can be 20 to 44 weeks. The next is Bell stage. Bell stage is, you can remember, 1A occult, blood and stool, 1A, 1B gross, blood and stool, 2A is PN, pneumatosis intestinalis, and the last one 3B is also PN, pneumoperitoneum. Then 2B portal vein gas, 3A ascites. ALK mutation in neuroblastoma. Age determination of child up to infant, that is 1 year, it is shoulder. Then 2 to 13, 1 to 13, 1, 2, 3, 4. So 1 to 13, then 2 to 14. 1 to 13, wrist and hip. 12 to 14, elbow. Then next, Jacksonian march is seen in focal seizure. Beta lactamase is an plasmid mediated. McKay is geno. so chromosome mediated. And MECA is responsible for MRSA. Filariform larvae infectious form L3. DEC provocation test is done in day. Without DEC you can take from night, but in day if you have to give DEC. Pulse is in spleen. B cells you can see in the follicle of both the lymph node and spleen. T cells you can see in paracortex and lymph node, whereas in spleen pulse, periarterial lymphoid sheath, and thymus only T cells. Node, you just read in reverse. Dawn, that is bacteria. RIG, rig, IR, virus. Classical is complex is for complex, antigen antibody complex. Alternate A then B, bacteria, which is used in plasma sterilization. Hydrogen peroxide. Endocarditis, most common cause, less than 1 year is cons, more than 1 year is cocci, that is streptococci. Penton-valentine toxin is related with the MRSA, whereas protein A is related with the coagglutination. Infant botulism is because of spores, whereas canned food poisoning, so that is toxin. Infant botulism is not toxin, that is spores. Arthrospore is seen in coccidioids and trichophyton. Adiponectin is inversely related to obesity. If the patient is so much obese, adiponectin will be low, whereas leptin is proportional to obesity. Leptin will be high, so leptin will decrease satiety. Deficient hormone in 21 hydroxylase deficiency, 21-2. So two hormones are deficient, AC, aldosterone, cortisol. 17 hydroxylase deficiency, there will be 21 may A and C, and 11 may only 1, that is C, cortisol deficiency. 17 hydroxylase deficiency of C and T, cortisol and testosterone. IPEX is associated with FOXP3 gene mutation. So T cells are involved. It is associated with D and E, dermatitis, enteropathy and endocrinopathy diseases. So E, enteropathy, endocrinopathy. F, FOXP3. G, H, hematopoietic stem cells and T cells related to that, and I is IPEX gene, and D, dermatitis. Hypokalemic periodic paralysis. Hypo is calcium related. Hyperkalemic periodic paralysis is sodium related. Sodium channel defect. Most successful age determination from which skull suture? That was the question, and the answer is sagittal. Adrenal pheochromocytoma mainly secrete norepinephrine. Vaccine associated paralytic polio. Within the administration of polio vaccine, OPV, around 40 days symptom onset and residual paralysis for 60 days because of this vaccine. Then you call it as VAP. So stay tuned till then, bye.